Okay, Ryan, so if you just want to share with the class any of your thoughts, diagnosis you've had, any parting words, and just
All right.
to the camera.
Currently, I'm diagnosed with post-traumatic stress disorder. I don't like that it's called a disorder. The reason I don't like it's called a disorder is because post-traumatic stress is simply a normal reaction to abnormal events. And if it's a normal reaction, why is it a disorder? And so my job allows me to advocate on a daily basis on many different platforms to educate the consumer that the reason it's a diagnosis is simply for, in my eyes, a billing issue. And then on the provider side, it's hard to tell somebody who wore a uniform that stands for everything that's right that something is wrong. And so I was in a 9-week intensive inpatient post-traumatic stress clinic in Topeka provided by the VA, and for the first time in my life in 2010, 2011 did I feel like I just wasn't crazy. Because for a long time I just thought that I was breaking at the seams, delusional. And when I got down there, guys and gals that were on the ward just said, "No, man, I got that. I got that too. I have that desensitized humor and that ugly anxiety and that shortened sense of future, nightmares and all that stuff." So there's that. In 2008, before my suicide attempt, I was misdiagnosed bipolar, and I thoroughly believe that is because of my substance abuse. If we take the alcoholic and the drug addict and we simply don't tell you about the substance abuse, and we just tell you about our highs and our lows, our mania and our depression, it would look like bipolar disorder. And I wasn't I don't remember, but I probably wasn't truthful at the time with the doctor about my consumption of alcohol. And in turn, which gave me the wrong medicine to ingest, which then threw me probably for a loop. And I just wasn't doing anybody any favors. And so the person that got through to me was the person who wasn't tactful, the person who didn't give a shit about my feelings, who didn't care whether I liked them or not. It was the person that simply said, "Dude, you need to be upfront, you need to be straight up, because I'm giving you chemicals to put inside your body that alter your moods, and I need to know exactly what's wrong with you." And it was only then did I surrender and get better. I wouldn't even call it surrender. I picked up my sword and started fighting with the people who were trying to treat me. I've also been, alcoholic, drug addict. I have, they called it something to do with my separation from the military, like a maladjustment disorder, and generalized anxiety disorder, which funneled into post-traumatic stress.
So do you know, Ryan, what the substance use disorders were? Or any diagnosis around those?
Other than
No?
chronic alcoholism.
Okay.
Just chronic alcoholism
Okay.
is all I saw. And I've taken a peek at some of that stuff because I needed those notes for my service disability, my disability for the service. And there's also a mild brain injury from my accident, which it explains the sticky notes all around my house like a serial killer was there. But there are, seriously, it's not cool.
Awesome.
But I use my phone. I use my calendar on my phone. I use a reminder deal on my phone. I have a whiteboard at work. I have a whiteboard at home. So there are ways to adapt.
Yeah, work around that.
Yeah, and we're in a world that, why want you to do 50 things at once, and how can I remember the 50th thing that I'm supposed to do?
Exactly.
So I'm not
Okay.
doing it.
Awesome.
Thank you.
Very good. You want to hit the stop button?